Hi everybody, I'm Dr. Adriana Karpati and I specialize in regenerative non-operative medicine at Foot and Ankle Associates of North Texas. I'm always excited to talk about the breakthroughs and advances in medicine, and this one involves the breakthrough in being able to replace the fat padding in your feet. So my question to you is, do you have painful corns and calluses? Do you have feet that are tender because you don't have the padding like you used to have on the bottoms of your feet? Do you have sores that heal and then break down again? You'll be happy to know that we are in the era of regenerative medicine, and there happens to be a product that helps to provide long-term relief that doesn't involve surgery. I'm all about getting the body to heal itself in any way that it can, and today I'm going to be talking to you about a product called LaNiva. LaNiva is a natural, sterile product. It's FDA approved, and it doesn't have any contraindications, which means that most patients are a good candidate. The product itself is minimally invasive. It's an in-office procedure. It involves an injection, but it does also involve the opportunity of getting long-lasting relief by actually making your own body produce its own fat cells to provide cushioning to the area in need. I'm sure there's many of you wondering why you couldn't just inject fat from one part of the body that you really don't want it in and inject it into an area that you do. The answer is pretty simple. Our body just doesn't have a way to contain that fat for any long period of time, so it eventually gets spread out relatively quickly. And LaNiva offers a way to contain the fat that you produce in the area that you want to produce it in. The best part is that it doesn't involve the operating room. So here's the way it works. Think of LaNiva as a scaffolding or a trellis of sorts for fat growth. Better yet, think of it as a honeycomb. So you've got this honeycomb, and you dump out all the honey out of the honeycomb. What you're left with is the honeycomb shell. Well, that's what LaNiva is. It is like this empty honeycomb, but this kind of honeycomb shell has the specific nutrients that your body wants and needs to be able to produce its own fat cells, or what doctors like to call adipose tissue, in the areas of the foot that don't have cushioning. So LaNiva gets injected into the areas of the foot or pressure areas where it has been damaged, and once it's injected, the nutrients in LaNiva direct your own fat cells to produce the adipose or the fatty tissue in those pockets. The best part is that the fatty tissue that's now been created to fill this honeycomb framework stays right where it is because it's in this framework, and that's what gives you this much needed longer lasting relief. So just to review some of the reasons why you might be a great candidate and why LaNiva may be a great option for you is if you're somebody who has the loss of the fat padding underneath your foot, where the padding has thinned out. Sometimes it's in the heels or the balls of the feet, or you have calluses on the bottoms of your feet or on your toes, or you have deformities in your toes that cause pressure points, and sometimes that can happen between your toes. Think of areas of painful scarring. Sometimes LaNiva can help with filling in underneath that scar tissue with some fatty tissue that can help to cushion that scar and decrease sensitivity. Diabetics could also benefit from LaNiva, that they chronically develop ulcerations that will heal with harder scarred tissue and then break down again. LaNiva can help to prevent this chronic breakdown process. If you suffer from any of these conditions and you're tired of padding your shoes, putting on creams, or having these corns and calluses trimmed by you, your podiatrist or your pedicurist, then I'm happy to give your body the push that it needs to take care of itself.